am here to suction a trachea, and I would introduce myself, and I would check her armband for name and date of birth, and I would let the patient know what procedure I'm doing, and then I would need her to give me a sign, let me know if she's having problems that I can stop and she can rest for a few minutes if needed. And I got all my supplies, and I've checked all the expiration dates, the packaging is okay, and I got extra supplies. And I'm going to put the bed up to a comfortable height for me, and then put her up a little bit more for semi-followers. Alright, and help my back, and put the side rail down, and then have all my stuff here, and I put a pad on her chest just to protect her gown and bedding. Leave her oxygen on. I need to turn on the wall suction. Get some non-sterile gloves, and the should be between 150 millimeters per mercury for adults. Got my gloves on. I'm going to take the tubing and check the suction. Make sure it is good, and it is. I'm just going to set it right there so it's handy. Then I'm going to remove my gloves, throw those in the trash, and then I'm going to open the packaging, which was opened before for practice. I'm going to take this out. I'm going to open. And I'm going to take out my little box, and I'm only going to be holding it on the outside so I can put saline in it, and I'm pouring it without splashing and with the label in my hand. And then I open this all the way, put on my sterile gloves first. I put on a splice shield and vest in case there is any splicing that goes on when I am suctioning. And I go ahead and get on my sterile gloves, and if they become contaminated, I brought extra to change out. Okay, now my dominant hand will always be sterile, and that's what I pick up this with. And I pull out my hand and hold that, and then what I want to do is make sure this is all covered up before. I want to make sure the patient takes deep breaths. I'm going to remove, to get oxygen, I'm going to remove oxygen. And now this hand is non-sterile. I'm going to attach this. I'm going to check the suction. And it's good. I'm going to insert. I'm going to tell the patient to take deep breaths, and she may cough. And I keep this open as I'm going in. As I go in, and then as I'm coming out, I turn it as this is open, and then I put it in the solution to clean out the catheter. And you should wait 15 to 15 to 30 seconds, I suppose, between attempts, and tell the patient to deep breathe and cough, and then I would try it again. And then I would also attempt the oral pharynx to see if there's any mucus in there. And then after that, I would wrap this up in my hand. Go ahead and disconnect. And return that. And remove my gloves. And dispose of. And I would use hand sanitizer. I can take this off by the ear things only and dispose of those. And I would go ahead and shut off that and clean up my and then I would offer the patient oral hygiene. I would return the oxygen as soon as I am done suctioning, and tell the patient they take some deep breaths, and then I would move the table out of the way. The side rail. Put the patient back down to a safe height. Make sure the patient has the call light and their table and water. And ask the patient what position they would like to be comfortable in. And then I could open the curtains or the door per patient preference. I would again do hand hygiene, and then I would document the procedure.